So next we have fate of thrombus. Okay, so as we know what is thrombus is nothing but, so as you can see in the picture, if this is the blood vessel, and as you can see here, pointer, yeah, so the blood cells, RBCs and the fibrin, everything clumps together and they form a thrombus. Okay, and after forming a thrombus they obstruct the flow of the blood. Okay, so what are the fates of the thrombus? What happens after the formation of the thrombus? So the worst case scenario is the patient will die if the thrombus is formed, let's say in a place where it is an essential organ which needs continuous blood. So if somewhere there the thrombus is formed, the patient will die because of the lack of the oxygen supply. But if the patient survives, okay, if the thrombus is formed somewhere else and it did not occlude the whole diameter of the vessel, so in that case what else can happen? So there are few things that can happen. One is propagation, then embolization, dissolution, organization and recanalization. Okay, so what does it mean by propagation? So propagation is nothing but, let's suppose if the thrombus is formed, okay, the thrombus is formed half like here. So okay, so let's suppose this is the thrombus is formed here. So in propagation, more amount of platelets and fibrin will deposit on this. After deposition of more amount of fibrin and platelets, the dome, the shape will increase in size, the thrombus will increase in size, and it will totally occlude the blood vessel. So that is nothing but the propagation of the thrombus. That is very dangerous. Okay, then what else can happen? The other thing, the best case scenario is dissolution or the lysis. If the tissue plasmin, there is something called as tissue plasminogen activator, okay, TPA. So what does it do? It lyses the thrombus. It completely clear out this thrombus, and then see the blood vessel goes back to normal state. Okay, so that is the best case scenario that could happen to a person. What else can happen? There is something called as embolism. What do we mean by embolism? So there is formation of the thrombus, and as you can see here, the particles of the thrombus is broken down from here, and then it is spreading out into the blood vessels. It is going somewhere else. So most common places, like for example the deep venous thrombosis, okay, there is something called as deep venous thrombosis from the leg. So the thrombus forms there, and the part of the thrombus break down from its parent thrombus chain, and it travels until the pulmonary arteries. Okay, so there it blocks, and it is a very emergency situation at that point of time. So embolism, there we have two types: arterial emboli and venous emboli. Venous emboli, it goes and embolizes into the lungs. Arterial emboli, it most commonly goes and embolizes in the kidney. Alright, see, there is embolism, and then there is infarct because of the lack of blood supply. Done. Then what do we have? Then we have organization and recanalization. What do we mean by organization? So here the thrombus is formed, and as you can see, the epithelial cells, okay, the endothelial cells of the blood vessels has formed on this. You can see. So yeah, the thrombus is taken inside this. Okay, so the new endothelial cells has been formed here, and that term is called as organization. Alright, then we have recanalization. What do we mean by recanalization? As you can see here, there is formation of the new endothelial channels, or new small tiny capillaries. So blood will come here and then flow through these capillaries and then go inside, and in the long goal this will be taken up into the wall of the arteries, okay, leaving a minute scar or something. So this is also one good way our body tackles thrombosis. Okay, but the important thing is, whenever a person is coming with this kind of thrombus, we need to react as soon as possible. Okay, because the older the thrombus gets, the difficult it becomes to clear that thrombus. Like here it says, the extensive fibrin deposition and cross-linking in older thrombi render them more resistant to lysis. This distinction explains why therapeutic administration of the fibrinolytic agent such as tissue plasminogen activator, example in the setting of an acute coronary thrombus, okay, is generally effective only when given during the first few hours of the thrombotic event. So if a person has come some issue that there is thrombus in his blood vessel, so as soon as possible if we can clear this thrombus, that would be the best decision. The thing is to not delay. The more we delay, the older the thrombus gets, the more resistant it becomes, okay, towards this plasminogen activators or thrombolysis. So then so organization and recolonization, so you can just pause and give it a read, you will understand. Then there is something called as mycotic mycotic thrombus. I don't think it is given here. So what is mycotic aneurysm? In this there will be additional along with this thrombus, there will be bacterial infection in the thrombus, okay, so that is mycotic aneurysm. Then anything else, lysosome and trapped, and you can just read all this. Smaller connective tissue that becomes incorporated into the vessel wall, eventually with remodeling and contraction of the mesenchymal elements, only a fibrous lump. So this is talking about the recanalization. This is the cross-sectional view. See how the endothelial cells they made their way inside, and this is how the blood will flow again. Okay.